Hey, it's Andrew here at the Ottawa Conference on Medical Education Assessment, very specific biennial conference in Melbourne. Here's a summary of some of my experiences from day 2. We start the day with Lambert Schuwerth, who's a fantastic Dutch background medical education researcher and leader in this area. We're lucky to have him at Flinders University in South Australia where I live. He talked about really how things are changing with AI, and we don't necessarily need to be afraid of it, not afraid of it stealing jobs, but we need to kind of go with the flow, I suppose. So his point was that generative AI, so the ability for AI to produce content, written and visual and audio, I suppose, is a tipping point. And he talked about that being a natural part of the democratization of knowledge through things like Wikipedia, through trust, through things like moving from institutions to community and a part of individuals, like the use of Uber, and I suppose other decentralized organizations like eBay is another great example of that. The democratization of communication through things like WhatsApp. You know, there was a time that you needed to pay for mail and phone calls, and now you can call and message and share information and communicate for free in most instances or with minimal cost. Democratization of teaching through the Khan Academy, YouTube, Instagram, lots of social media and other things that are available online, free and paid. And now we're democratizing cognition through AI. And so I thought that was a nice kind of picture that this is a natural progression, and like we don't need to, it was disruptive when each of those other changes came through. Now we just see it as a normal way and we wouldn't live without it. And he also made the point, if AI can perform the task, what is the relevance or validity of the assessment of that task in that case, which is another theme of going, as they talked about board exams in the American context. If ChatGPT can pass the exam, is the exam still valid, rather than being like, you know, fearing ChatGPT? It's more exposing that our methods need to evolve and change, and they're not. He talked also about the conflict of values between providing education and assessment and trying to align those. And so when you're trying for people to learn, you're trying to people be open-minded and be broad in their thinking and be curious. And whilst when you're using it, assessments, it's very specific and it's reasonably narrow focused, and it causes a lot of tension and closed thinking around the expression of knowledge through assessment, and that we want to try and align those things more together. I've got a slide, I'll just put that up now, that you can check out. Aligning those values, easy in theory, hard in practice, but we need to try for that, is one of his main points. Assessment needs to be for learning, not of learning. And that needs to be more than just formative assessment like feedback. It needs to be deeper and more varied. We need to have more narrative in assessment, not just scores. And I actually think that's a theme I'm seeing at the conference in general, is this idea that we're assessing things, and I think he made the point that when you're diagnosing someone, there's a lot of narrative to that diagnosis, there's a lot of elements that have brought you to that diagnosis. And in the same way, if we're diagnosing someone's competency or entrustability or knowledge, you can't just put it down to this score means this thing. It needs to be more narrative there. I don't know exactly how to do that yet, but I really like the idea that's there. And he also made the point that the technology-afforded learner is not the exception. That is the new norm. And so we need to teach and assess with the assumption and even enabling that technology affordance to be more consistent and equitable for all. We need to have distributed assessment, which is connected, and the assessment is a diagnostic process, not a measurement, as I was just saying before, that diagnosis idea. And so programmatic assessment is supportive of a diagnostic assessment process rather than just scoring. There was a quote, "You will not be replaced by AI, you will be replaced by someone with AI." And so really we need to be adopting and working out how to use AI in our practice and in our assessment and in our teaching sooner rather than later. Then I went to a session on EPAs that was more workshop based and more discussion things. I don't know if there was any one particular thing that came out of that, but it included discussing the AMC 2-year framework and some other EPAs used in other areas. Met some lovely people and made some connections there. Then went to a other area that had a series of abstracts. One of them was on point of care ultrasound, and the point was that there's no regulation in most countries or systematized teaching around use of point of care ultrasound or POCUS. And I didn't know this, but it's in the World Health Organization's top 10 dangers for the quality and safety of healthcare in this era. I'm a user of POCUS, and I certainly feel that it's a very powerful tool, but one that we need to use properly. So that's exciting to work on. Then there was another short presentation on ClickWise. So they were looking at Year 3 students doing exams and looking at the patterns of whether they revisited questions and whether they changed their answers. And so they found in this reasonably small study of one particular year group, one exam, there were better results for people who reviewed their answers, and there were worse results for people who changed their answers, so, which is interesting. And the summary was, at least in this really small, more like a pilot study, it's good if you're reviewing and thinking, but probably don't change. And that kind of fits with Adam Grant's book, Think Again, where he was saying that a lot of the time people who change their answers are incorrect. But there's a lot of studies that kind of talk about people that change and review answers being a good thing. So I think that's a question that hasn't been completely answered there, or conclusively answered. Then I went to another workshop that was called Death of the OSCE, and are we shifting from OSCEs, which is the Observed Structured Clinical Examination, to workplace-based assessments? I think the summary was the OSCE isn't dead, but it is a very resource-intensive mode of assessment. It still has a place in undergraduate and postgrad education in various forms, but we're probably using it in a more narrow and more specific way than we used to, especially when it first came out. We were using it for lots of things. And I think the other summary was that workplace-based assessment can't replace everything that OSCE can do. We need to have a full range of assessment methods, including the OSCE, including workplace-based assessments, and continue to work on the quality and the validity and reliability of those assessment methods in each of our contexts. I like the paradigm or analogy that the OSCE is like a factory. You put in a bunch of resources and you get out a bunch of stuff, and sometimes we've been using that factory to produce a lot, and there's a lot of resources, time and effort going in to produce that other stuff, and we probably need to review and refine that use and go, we just need to put in these particular ingredients to get out these results in terms of assessment. Lastly, there was a plenary by Susan Schutt from Delft in the Netherlands, and she talked about nurturing learners' agency of assessment within trusted relationships. And so the point being, I had to leave early to go to a musical, Tim Minchin's Groundhog Day, which is fantastic. Check it out if you can. But what I kind of took from that was that the idea, when we have a lot of assessments, there's a lack of agency by the learners, and if we can build some of that back in so that there are choices and there is some agency with the learners, it's going to make those assessment methods less stressful and hopefully more authentic. So that was day 2, and I hope that's interesting. Let me know what kind of stood out to you, and the next upcoming conference in this realm that I'm doing is the ANZAPE conference, the Australian New Zealand Association of Health Practitioner Educators, and that's happening in July 1 to 4th in Adelaide. Hope to see you there if you're interested in this area. See you soon.